Welcome to the recorded version of Aging Brain Part 2, Aging Brain Diseases, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and generous sponsorship from Home Instead Senior Care.
Okay, our presenter today is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I'm going to turn the floor and the presentation here over to Lakeland Hogan. Thank you for joining us this morning, Lakeland.
Thank you so much, Steve. Hello, everyone. Thank you all for joining us. I'm so glad that you're taking time out of your day to tune in to this topic, Understanding the Aging Brain Part 2, and today we're going to be talking about aging brain diseases. So last month we covered how the brain ages and distinguished between normal and abnormal aging, but today we're going to talk about what happens when abnormal brain aging occurs and what aging brain diseases result from that. Many people experience the normal changes as they age. However, there are a significant number of aging adults that start to experience changes in their cognition that impact their daily life. So this is a sign that they may be developing an aging brain disease. It could also mean that there's something else going on in the body, but if cognition changes start to occur, it's really important we encourage individuals to seek medical or professional medical evaluation. But these diseases can abnormally affect a person's memory, cognition, functioning, and people affected by these aging brain diseases might start to exhibit symptoms that interfere with their daily life. And these symptoms can sometimes be scary, overwhelming to the older adults that are experiencing the symptoms. It can also be a time of uncertainty for the older adult and for their families. So as professionals, we're all often consulted on information about these aging brain diseases, and people come to us as professionals to seek out support and resources. So I'm grateful again that you've joined us today so that you can learn better how to communicate with families about this normal versus abnormal brain aging as it relates specifically to aging brain diseases. So I'm going to start by just going over our objectives here quickly on the first slide. So by the end of today's webinar, my hope is that you'll learn about the warning signs of abnormal brain aging and when they might be occurring, be able to describe the importance of early diagnosis and detection of these aging brain diseases. Also, we're going to go over the various aging brain diseases, at least the ones that are most common in older adults that we work with. So I hope that you'll be able to distinguish a little better between those various aging brain diseases. And then at the end, I'm going to go over some resources that you can connect the people that you work with, the older adults, family caregivers that you work with, to hopefully help them better support them as they learn about these aging brain diseases and connect to resources. So with that, I'll start out by overviewing normal versus abnormal brain aging. So if you joined us for part one of this two-part series of Understanding the Aging Brain, this slide might look familiar, so I apologize, but I do want to get everyone up to speed. So when we look at normal versus abnormal aging, normal aging of the brain is associated with some cognitive decline, but it's generally subtle, and it might impact a person's speed of thinking, their attention control, and their ability to multitask. That might become a little more difficult. And also that little bit of forgetfulness that you might start to notice more and more as you age, that's a normal part of aging. For example, if you've ever gotten up off the couch and walked into the other room and found yourself thinking, what in the heck did I come in here for? That usually isn't a concern of abnormal brain aging, because usually when you walk back into the room and sit back down on the couch, you think of it again, or in the middle of the night you spring up, that's what I was going in there to get. So eventually we come back to it, whatever we were trying to think of. You may have also experienced this when you have parked your car. You go into the store, you come back out and realize, oh goodness, where did I leave my car? And usually we're able to retrace our steps and eventually remember, oh yeah, I parked next to the light post this time. But if an individual is no longer able to get back to that memory of where they parked the car, or if they do not remember what they got up off the couch to get, if that memory never comes back to them, that's when it might be a sign that abnormal brain aging is occurring. And we do know that abnormal brain aging, it's not universal, meaning it does not impact everyone, nor is it inevitable for everyone. So, but for those who do experience abnormal brain aging, it is pathological in nature. So there is something happening to the brain. And on the screen here, I have a visual of a healthy brain versus a brain of someone living with Alzheimer's disease, advanced stage of Alzheimer's disease. So as you can see, the left side of that brain is very healthy. The tissue is pink and white. The folds look very healthy. Everything looks good. But if you look on the left side of the brain, you'll notice that there is thinning of the white matter, thinning of that cerebral cortex, and there is shrinking of the brain and the hippocampus. There's also the enlarged ventricles on the right side of the brain. So the folds are a little deeper, a little thicker. You can even see towards the middle how there is what kind of looks like Swiss cheese, some holes in there. So the pathology or the disease that's causing Alzheimer's disease is causing the brain to shrink in size and is causing more of a pathological a disease state. And again, that presents eventually in symptoms of Alzheimer's disease, which I will go over later in the presentation. So, and Alzheimer's disease is just one type of aging brain disease, but it just gives you kind of an idea visually on the slide here of how a healthy brain compares to one of the aging brain disease that could be occurring. So a little bit more on the abnormal brain aging. As you can see on the slide, abnormal brain aging often involves symptoms such as decline in cognition that are more severe, may include other abilities such as our ability to think. It might also cause rapid forgetfulness or difficulty navigating. Sometimes people have issues with solving common problems or expressing themselves in a conversation, or they might start to behave outside of what we consider to be social norms. Abnormal brain aging symptom could also include issues with the motor system that might result in excessive tripping, more frequent falls, or even tremors. And so as we go through the various aging brain diseases, you'll start to see that these signs of abnormal brain aging will start to kind of fall within the categories of the various aging brain diseases. But before we go deep into the various types of aging brain diseases, I did want to talk about the fact that often these diseases are underdiagnosed, especially dementia. And I'll talk more about the types of dementia, but dementia is an umbrella term. And oftentimes when people are experiencing abnormal brain aging symptoms such as forgetfulness or losing their ability to think of words, losing their ability to concentrate, they usually go to their primary care physician with these concerns first. However, depending on the report that you look at, a primary care physician fails to diagnose dementia anywhere from 24% of the time to 72% of the time. That's a really high number of cases that go undiagnosed. And this is really unfortunate because they are, again, that first person that older adults often go to help identify the risks for dementia illnesses. So there really are a couple factors that contribute to this underdiagnosis. First of all, the family might be in denial that the individual is having any sort of cognitive impairment. Also, the medical professional, if they're not educated on the various aging brain diseases and the cognitive deficits that are associated with them, they might think that it is a normal part of aging. Or sometimes I've heard medical professionals feel that if they don't have a cure or somewhere to send them once they give a diagnosis, they're less likely to give that diagnosis. And really, these various obstacles and barriers to diagnosis can really, of course, be negative for the individual because they're not getting the answers that they need. But usually it delays an eventual diagnosis anywhere from 1 to 2 years, even up to 4 years. That it takes an individual to get a diagnosis. So researchers and various advocacy organizations like the Alzheimer's Association, they're working hard to educate primary care physicians on aging brain diseases, the signs, the symptoms, the ways to diagnose, and refer patients on to specialists who can do a very thorough examination of cognitive issues that might be happening. And so hopefully we will see that percentage that's on the screen there begin to shrink. So it is a large focus in kind of the field. And so hopefully, again, we will see progress in the diagnosis. And there's been more sophisticated ways to diagnose these aging brain diseases over time. Researchers are able to diagnose it more in a more sophisticated manner than they have in the past. And so know that while dementia is often underdiagnosed, it is still very important to get a diagnosis because there are some benefits, which we're going to go over here on the next slide. Some people argue, again, that because there's no cure for these aging brain diseases and there's a limited number of medications or treatment, then they shouldn't even bother with a diagnosis. But while this is a fair question for people to ask, a diagnosis can really help the individual with the aging brain disease and their families get connected to resources, education, and the available medications or treatments that do exist. So one of the most important reasons for an earlier diagnosis of these aging brain diseases is the ability for families to plan ahead. Unfortunately, these aging brain diseases are progressive in nature, meaning that they will get worse over time. And because of that, it does usually progress to a point where the individual can no longer make decisions for themselves. And so if families are able to recognize early on that they're needing to plan ahead for the individual's future care needs, whether it's the legal, financial, or the care planning, that can be really beneficial because that individual will get to have a say in that planning of their future. So it really is important to ensure that the voice of the person with dementia or whatever the aging brain disease is can be heard and involved in that planning process. Also, by making wishes known to the family members, to the care team, it can help reduce feelings of guilt, ambiguity. It can also help with the emotional aspects of having a diagnosis, sadness, grief, those types of feelings. And knowing that you've had the opportunity to talk with your loved one about their wishes, when it comes time to make those decisions down the road, it helps families make those decisions with more confidence. They don't have to spend as much time deliberating. It also can reduce the stress and the guilt that often is associated with some of those big decision-making points along the person's journey with Alzheimer's and dementia. So again, it's really important to encourage this early diagnosis for these reasons. Also, a diagnosis can help the person with dementia or the aging brain disease get to a proper specialist for further evaluation. It could also open the doors for participation in clinical trials, the latest access to treatments, better medical care, that sort of thing. So again, it's very important for that diagnosis. And then we also know that an earlier diagnosis does have an economic impact. Earlier diagnosis can have a cost savings in terms of medical and long-term care costs, not only for families and the individual living with the disease, but also for the healthcare system in the U.S. government. So among all Americans alive today, if those who will get Alzheimer's disease were diagnosed when they had mild cognitive impairment, which I'll go over what that is in just a moment, then it could result in an estimated savings of up to $7 trillion to almost $8 trillion in health and long-term care costs. So again, if we're able to diagnose earlier on in the disease progression, again, that planning can happen. Financial planning, legal planning, care planning can happen, and in the long run, that can save in terms of an economic value for all parties involved. So we've kind of gone over the importance of this early detection diagnosis, and now I'm going to go into the various aging brain diseases. So I just talked about mild cognitive impairment, and so I'm going to go into a little more detail on what that is, and then I'm going to talk about the various types of dementia. And again, dementia is an umbrella term. It's not a specific disease, but it's an overall term that describes a group of symptoms that are associated with decline in memory or thinking that is severe enough to reduce a person's ability to perform everyday tasks. The most common type of dementia is Alzheimer's disease, but there are other types of dementia: frontotemporal dementia, vascular dementia, and Lewy body dementia. Those are the most common that we see in the aging population. So I'm going to dive deeper into those various types of dementia. And I'm also going to talk about Parkinson's disease. We're seeing Parkinson's more commonly in the aging population. So let's start by talking about mild cognitive impairment, which they also refer to in the medical field and the research field as MCI as the acronym. So mild cognitive impairment affects memory to the point of being noticeable to others, but not necessarily noticeable enough to really interfere with the daily function of the individual. So people with mild cognitive impairment might exhibit some forgetfulness or amnesia of recent events. They might need to write themselves notes or reminders to do things that they would otherwise forget. However, they still can perform daily tasks, paying the bills, taking their medications without directions. They can care for their personal care needs. So again, it's not impacting their daily function to a point where they need regular assistance. But again, there is some forgetfulness that goes beyond normal aging. So while people with mildly impaired memory can function relatively normally, the condition is of concern because nearly half of individuals with MCI eventually develop Alzheimer's disease within 5 years of getting diagnosed with MCI. So this is really important for families and medical professionals to pay close attention to, because again, if the MCI progresses and becomes more true Alzheimer's disease, that sort of thing, then it's something that the families want to keep on top of, regular medical appointments, regular evaluations. And actually, if you are over 65, the Medicare wellness visit here in the United States now includes a cognitive assessment. So that's an easy way for older adults, even if you're not noticing any problems with their memory or impaired judgment, impaired cognition, it's a good way for your medical professional to evaluate your cognition on an annual basis. That way, if there's any change in cognition, then hopefully a diagnosis can be given earlier on, or perhaps it's not aging brain disease. Perhaps it's something else that's going on in the body that needs medical attention. So again, staying on top of any sort of cognitive decline or cognitive issue is really, really important. So as I mentioned, MCI is a precursor for Alzheimer's disease for about half of the people who are diagnosed with Alzheimer's or with diagnosed with MCI. So now we're going to talk about Alzheimer's disease. So again, I mentioned Alzheimer's disease is the most common form of dementia. Again, dementia is an umbrella term, and we see Alzheimer's disease occurring in about 60 to 80% of all dementia cases. So it tends to get a lot of attention, a lot of focus. So actually, on today's webinar, I'm going to try to go through Alzheimer's disease a little more quickly. That way I can spend more time on the other aging brain diseases. And next month, as you heard at the start of the webinar, I'm covering caring for someone with dementia. I'll be talking a lot about Alzheimer's in next month's webinar, so I hope that you'll join us for that. But for Alzheimer's disease, the greatest risk factor is age. So we know that as a person ages, their risk of Alzheimer's disease increases. Doesn't necessarily mean they're going to get Alzheimer's disease, but again, we know the greatest risk factor is age. Family history also increases a person's risk. So if you have someone in your family, mother, father, grandmother, grandfather, aunts, uncles, again, it could increase your risk of Alzheimer's disease, but does not guarantee that you will develop Alzheimer's disease. There's also a genetic component that can increase your risk. Again, does not mean you will be guaranteed to develop Alzheimer's disease, but there are certain genes that put you at a higher risk of Alzheimer's disease. But what scientists are learning is that these changes in the brain, they're really these microscopic changes that begin long before the first signs or symptoms of memory loss. I was just at the Alzheimer's Association's International Conference, and they were talking about how Alzheimer's disease can start developing in the brain 10, 20, even 30 years before Alzheimer's disease symptoms start to become noticeable in the individual. So the hallmarks or the key scientific indicators of Alzheimer's disease are plaques and tangles in the brain. And so these plaques and tangles develop over time, and they impact the ability for brain neurons to communicate with one another. And so those brain neurons start to die, and that's what's causing the pathology in the brain. I wish I could go into more detail. I could talk about that alone for just an entire hour. But we do know that this plaque and tangle buildup in the brain is what is likely causing Alzheimer's disease. At this time, there's no known cure or treatment for Alzheimer's disease. There are medications that can reduce the symptoms, but these medications cannot stop or reverse the progression of the disease. And there are generally three stages of Alzheimer's disease. Some people will talk about it in 5 stages. I like to simplify it and talk about it in 3 stages. The Alzheimer's Association also talks about it in that way. So there's mild, moderate, and severe, also referred to as early stage, middle stage, late stage. So in the early stages of Alzheimer's disease, a person may function independently still. He or she may still be able to drive, they may still be working, engaging in their social activities, but despite this, he or she might recognize that they are having memory lapses. For example, maybe they're forgetting familiar words or the location of everyday objects. If you've seen the movie Still Alice, that's a good one. In that movie, Alice gets to a point where she's on a jog of which she's gone on that same jog probably every day for years and years and years, and finds herself stuck not remembering how to get home. And so that was one of the earlier signs to her that there was something wrong with her cognition. So again, in the mild early stage, they're still able to function. People might start to notice difficulties, and oftentimes a detailed medical visit is something that a person will undergo to detect what is the root cause of these issues with memory or concentration. And in the moderate stage of Alzheimer's disease, this is typically the longest stage and can last for some people many, many years. And as the disease progresses, the person with Alzheimer's will require a greater level of care. And at this stage, the dementia symptoms are often noticeable to those around the individual. The person might have difficulties performing common tasks like paying the bills, doing housework, keeping up with the day-to-day taking their medication, that sort of thing, cooking their own meals. They may still remember significant details about their life. Oftentimes, it's those distant past memories that are the ones that they tend to hang on to the longest. But the individual might also start to confuse words. They might get easily frustrated or angry. They might act in unexpected ways. And at this point, again, these symptoms are very noticeable to others. And then in the final stage of the disease, this is when the symptoms become pretty severe. The individual loses the ability to interact and respond with their environment. They're likely unable to carry on a conversation, or it might be a very broken conversation with short sentences or a few words. And eventually they lose control of their movement of their body. And at this point, the individual is likely to need very extensive help with activities of daily living. They're completely dependent on others. They usually cannot be left alone. And eventually, the individual will pass away from complications of Alzheimer's disease and the body completely shutting down as a result of, the pathology, the disease in the brain. So again, that's just a brief overview of Alzheimer's disease. I hope you join us next month to learn even more. But now I'm going to transition on to the next type of dementia, which is frontotemporal dementia. So frontotemporal dementia is often abbreviated FTD, and this represents a group of brain disorders that's caused by the degeneration of the frontal and or temporal lobes of the brain. It's also frequently referred to as frontotemporal degeneration. So FTD, frontotemporal degeneration, and oftentimes referred to as frontotemporal dementia. And like Alzheimer's disease, it is a progressive disease, and it can vary in an individual between a 2-year to 20-year progression in the disease. So it really is individual. But there are key differences between FTD and Alzheimer's disease. Pardon me. And the first key difference is that FTD and Alzheimer's disease tends to have different symptoms. FTD brings along gradual progressive declines in behavior, language, or movement, and the memory is usually actually preserved in FTD, where a hallmark symptom of Alzheimer's disease is memory loss. FTD also typically strikes younger than Alzheimer's disease. The onset can range anywhere from age 21 to 80 for FTD, but the majority of cases occur between age 45 and 64. So the result when somebody's diagnosed at a younger age is an impact on work, family. There's oftentimes a heavy economic burden. And then one of the last things that differentiates FTD from Alzheimer's is that FTD is often less common and less known than Alzheimer's disease. There's actually about 60,000 cases in the U.S., and many people in the medical community remain unfamiliar with FTD, and it's often misdiagnosed as Alzheimer's disease, depression, Parkinson's, or a psychiatric condition. And oftentimes it takes on average 3.6 years to get diagnosed accurately with FTD. We do know that FTD has a genetic component. At least half of FTD diagnoses are sporadic, meaning that none of their relatives are known to have FTD. So about half are sporadic, and about 40% of individuals who have FTD do have a family history. So it's almost 50-50. If somebody has FTD, they are 40% likely chance that they have someone in their family who has had FTD, but for at least half it is sporadic. But there are various groups of brain disorders kind of within this FTD realm. And the two most common are up there, and then there's also disturbances of motor function that often occur. So behavioral variant temporal dementia, they often abbreviate this as BVFTD. In this type of dementia, the hallmarks are personality changes, apathy, and a progressive decline in socially appropriate behavior, judgment, self-control, and empathy. So unlike Alzheimer's disease, where memory, again, is often affected, it doesn't usually occur in behavioral variant FTD. So people with behavioral variant FTD typically do not recognize the changes in their own behavior. They often exhibit or they often do not exhibit awareness or concern for the effect that their behavior has on those around them as well. So that can be very challenging for family caregivers. And then the other common type of FTD is primary progressive aphasia, PPA, which is the abbreviation. This is the second major form of frontotemporal dementia that impacts language, speaking, writing, and comprehension. So it's usually characterized by the gradual loss of the ability to speak, read, write, and understand what others are saying. There are several clinical subtypes of PPA. I don't have time to go into those now, but again, this is another common type of dementia. I remember working with a gentleman who did have PPA. He looked physically fine, but was not able to verbally communicate, which was a really great challenge for his wife. And so we had a caregiver going in there to give the wife a little bit of a break. He was still able to play cards, go out and about for walks, but just could not verbally communicate. And then again, there are disturbances of motor movement or muscle function that can go along with various types of this behavioral variant FTD. But again, there's many different types, but the most common ones that we see occurring for those diagnosed with FTD are that behavioral variant and then the PPA. And as I mentioned, it is a somewhat younger diagnosis when you compare it to other aging brain diseases. So I did want to touch on the symptoms in a little more detail. Again, the age of diagnosis might be an important clue for distinguishing FTD from other types of aging brain diseases. And the common symptoms really revolve around behavior, language, and movement. So again, you might see in an individual symptoms of disinhibition, a lack of restraint based on social norms, apathy, which is an indifference or lack of interest in previously meaningful activities. They might experience emotional blunting, which is a loss of warmth, empathy, or concern for others. You might also see symptoms of compulsion or ritualistic behaviors, a single behavior that becomes routine or that the individual performs over and over again. You might also see changes in the individual's eating habit or diet. It might be excessive, compulsive eating or drinking. And then you might also see deficits in their executive function. So poor decision making, poor judgment, issues with problem solving and organizational skills. I know a family caregiver who said one of the early symptoms was that her husband was making very poor financial decisions that he normally would never make. So again, these symptoms, if a family member sees a symptom which is completely outside of the norm for their loved one, these are signs that further medical attention is needed. So today there's no cure for FTD, unfortunately. There are no treatments that can slow or stop the progression of the disease. But again, it's still important for a diagnosis and to connect individuals to resources. And there's a great association for frontotemporal degeneration, and I'll share their information on the resource slide at the end of today's webinar. But next I'm going to talk about vascular dementia. This is another common type of dementia that we see in the aging population. It's often known as vascular cognitive impairment, or VCI, and it's caused by an inadequate blood flow that can damage and eventually kill cells really anywhere in the body. But the brain has one of the body's richest networks of blood vessels, which makes it especially vulnerable. So vascular dementia can often develop after a stroke. A stroke can block an artery in the brain, but strokes don't always cause vascular dementia. But again, often there can be a correlation. Vascular dementia can also result from other conditions that damage or narrow blood vessels. It can result from reduced circulation in the blood vessels, and when this happens, it's depriving the brain of vital oxygen and nutrients, which then causes damage. And symptoms can vary widely depending on the severity of the damage in the brain and what parts of the brain are impacted. Oftentimes, too, it can be occurring along with another type of dementia. So, for example, someone might have Alzheimer's disease and vascular dementia. And memory loss may or may not be significant in this type of dementia, again, depending on what part of the brain is impacted. Factors that can increase a person's risk of heart disease or stroke are also tied to whether or not somebody develops vascular dementia. So what's good for your heart is good for your brain, essentially. So people who have diabetes, high blood pressure, high cholesterol, and smoking, this might raise the individual's risk for vascular dementia. So controlling these factors can help, again, reduce the risk of the development of vascular dementia. So prevention or healthy chronic condition management is a good way to reduce the risk. So we look at the various symptoms of vascular dementia. There are a lot here on the screen, but again, it's because the symptoms will vary based on the areas of the brain that are impacted. So confusion, concentration issues, difficulties organizing thoughts or actions, decline in ability for planning, memory issues, restlessness, irritation, an unsteady gait, continence or incontinence, depression and apathy can be symptoms. We also see in the aging population mini strokes that can impact the risk for vascular dementia. So these are small strokes that might happen a little more frequently. Again, these are all symptoms that we would want to educate families on so that if their loved one's exhibiting these symptoms, they get the proper diagnosis. So we've gone over vascular dementia now, and I'm going to skip Lewy body dementia and go to Parkinson's first, and you'll figure out why, because the two are related. Parkinson's and Lewy body are related, but I do want to make sure that we have a good understanding of what Parkinson's disease is. So Parkinson's disease is a neurodegenerative disorder that affects predominantly the dopamine-producing neurons in specific areas of the brain called the substantia nigra. So there are various subclinical types of Parkinson's disease. There's one that's a tremor dominant, which is the most common. There's also another more common one called postural instability gait difficulty. It is abbreviated PIGD. So lots of acronyms in this presentation today. I apologize. But the exact cause of Parkinson's disease is really not known, but scientists believe that a combination of genetic and environmental factors are the cause. But the extent to which each factor is involved varies from person to person. So researchers don't know why some people develop Parkinson's and others do not. But when it comes to the genetics, it's believed to cause about 10 to 15% of all Parkinson's cases. In some families, changes or mutations in certain genes are inherited or passed down from generation to generation. So if Parkinson's seems to run in the family, again, that doesn't mean the individual is guaranteed to get Parkinson's disease, but it could put them at an increased risk. We also know that age is a factor. Of the whole population of 60 plus, 1% of the population has Parkinson's disease, so we do know age is a risk factor. And also men tend to have Parkinson's more often than women, but both genders can develop Parkinson's disease. And scientists are working to get a better understanding of the broad range of environmental exposures that are linked to Parkinson's disease. Again, most people think it's a combination of genetic factors and environmental factors. So environmental factors could include a variety of things. Your mind probably goes right to the outdoors. I don't know if you've heard, but they think that there might be a tie between pesticides and herbicide exposures, various solvents that are tied to Parkinson's disease, but also an environmental factor would be something like a head injury could put an individual at a higher risk. Also, exposures to various metals might put an individual at a higher risk. So again, researchers are still looking into these relationships, but the research is mixed. And again, it's that combination of environmental factors and genetics, and of course, again, age is a factor. So currently, when we look at Parkinson's disease, there is no cure, but there are treatment options. So again, very important for an individual to be diagnosed if they truly have Parkinson's disease, because there are medications that can help treat the symptoms. And some people do qualify for deep brain stimulation, but there are specific criteria for that. So when we look at the symptoms of Parkinson's disease, we see tremors, bradykinesis, which is the slowness of movement or creating issues with gait, muscular or limb rigidity, postural instability, weakness of the body on one side, both sides, tremors. Again, there's often a strong tie to emotions, especially as tremors become greater. There might be a mismatch of facial expression and emotion. There might be changes in the individual's voice. It might become softer, more of a stooped posture, changes in a person's writing ability. It might become more difficult to write, or changes in the appearance of the handwriting. Pardon me. And there are 5 stages of Parkinson's disease, so I'll go through those quickly here. Also on this slide, you can see on the right hand the part of the brain that is impacted by Parkinson's disease. Kind of gives you a little context. But in the first stage, the initial stage, usually the person has mild symptoms that do not interfere with daily activities. Kind of sounds like the first stage of Alzheimer's disease. So this first stage is not necessarily impacting their daily life to the point where they need assistance, but they are starting to see tremors and other movement symptoms occurring generally just on one side of the body. So changes in posture, walking, facial expressions, those kinds of things might start to occur. In stage 2, symptoms start to get worse. More tremors, rigidity, other movement symptoms might affect then both sides of the body. They might experience problems with walking. Poor posture might become more apparent. The person, again, might still be able to live alone independently, but those daily tasks are becoming more difficult, often taking them longer. And then the mild stage or third stage of progression, this is when there becomes issues with a loss of balance, a slowness of movement. Falls become more common. Person has still some of their independence, but it might start to impair their activities of daily living, such as their ability to eat or dress. And then when we look at the next stages, at stage 4, at this point, symptoms are becoming more severe and limiting. It's possible that the person might be able to still stand with assistance, but the movement might require a walker. The person might also need help with their activities of daily living and is oftentimes unable to live alone at this point in the disease process. And then stage 5, this is the most advanced and debilitating stage of the disease. Stiffness in the legs might make it impossible to walk or stand, so they might require a wheelchair or might be entirely bedridden. And oftentimes around-the-clock care is needed for all of their activities of daily living. And a person might also at this point experience hallucinations or delusions. And that's how we segue into Lewy body dementia, because Parkinson's disease often is associated with Lewy body dementia. So we're going to talk about that as the last aging brain disease for today's webinar. So Lewy bodies, you can see the picture on the screen. There's an arrow pointing to a Lewy body. These are abnormal clumps of proteins inside of the neurons that can cause damage, which reduces the ability for signals or these neurons to signal to one another. And again, it can result in cell death, similar to the cell death in Alzheimer's disease. Again, it's common with Parkinson's disease, and there are really 3 presentations of Lewy body dementia, often abbreviated as LBD. So some individuals will start out with a movement disorder that leads to a diagnosis of Parkinson's, and then they later on develop dementia. So this diagnosis is often described as Parkinson's disease dementia. Another group of individuals will start out with cognitive or memory disorders that might be mistaken for Alzheimer's disease or might be a misdiagnosis, but over time, two or more of the distinctive features of LBD become apparent and lead to the diagnosis of dementia with Lewy bodies. Sometimes it's abbreviated as DLB. And then lastly, a smaller group will first present with the neuropsychiatric symptoms, which include the hallucinations, behavioral challenges, difficulties with complex mental activities, which will lead to an initial diagnosis of dementia with Lewy bodies or LBD. So again, LBD, somebody might start out with Parkinson's and then be diagnosed with LBD. Somebody might start out with the Lewy body dementia symptoms and start to develop more of the other symptoms, and then a small group might start with those more hallucinations and other psychiatric symptoms that then lead to that diagnosis. So what are those symptoms? So for Lewy body dementia, the symptoms are commonly changes in their ability for thinking and reasoning, varying levels of confusion and alertness. And confusion and alertness in this type of dementia significantly varies from one day to another. Also, Parkinson's-like symptoms such as a hunched posture, balancing problems, rigidity of muscles is also common symptoms. Those hallucinations and delusions that I've been mentioning, trouble interpreting visual information, acting out of dreams, sometimes violently. This problem is known as rapid eye movement sleep disorder. There's also a tie with Lewy body there. Malfunctionings of the autonomic or nervous systems, and then memory loss that may be significant but less prominent than Alzheimer's disease. So those are the symptoms that are commonly associated with Lewy body dementia. So if you think back to all of these aging brain diseases and the symptoms that I've mentioned for each, I mean, it's no wonder that it's hard to diagnose these aging brain diseases because so many of them have similar symptoms, but they in fact are different diseases that are impacting the brain. So when families get discouraged about the diagnosis process, the best thing we can do as professionals is support them and try to help them get to the correct medical professionals or specialists because for some of these aging brain diseases, it can be a slightly longer diagnosis process. But before we go to resources, I did just want to do a quick plug for clinical trial participation. These aging brain diseases are being studied across the country, across the globe. We're trying to get a better understanding of how these pathologies in the brain, these diseases of the brain are impacting people and how we can develop treatments and hopefully a cure. So when an individual is diagnosed with an aging brain disease, hopefully they're given the opportunity or told about clinical trial participation. This can provide a sense of hope and optimism for the individual and their families. While there's no cure today, participating in a clinical trial can help future generations. And participants are needed that are both healthy participants and those who have cognitive impairment or the aging brain diseases. Especially oftentimes the people who have a family history of these aging brain diseases, clinical trials are seeking out those types of individuals. And there are some benefits of participating. Oftentimes an individual is able to gain access to potential treatments before they're made widely available. They receive expert medical care at the leading healthcare facilities, and often this is free of cost. A lot of times, clinical trials even reimburse families for things like mileage or give them a stipend towards their efforts that they're making to participate in the trial. And also gives access to things like PET scans. I know a gentleman who was unable to get a PET scan, which is one of the newer technologies. It's a very expensive brain imaging technique, but through a clinical trial and participating in the clinical trial, he was able to have a PET scan and was able to see the results. So again, these clinical trials, I think sometimes people see them as negative, or people are fearful of clinical trials. We think of the hamster wheel or adverse drug medication or adverse effects of drugs, those types of things. But often clinical trial participation is a positive thing. I've heard so many people talk so positively about clinical trials. Sometimes they are frustrated on trying to figure out what trials they qualify for, trying to find them. And so on the next slide, I'm going to give you some areas, some resources where you can send people who are interested in clinical trial participation. But again, participating in clinical trials really does help future generations and helps to contribute to research, kind of that bigger picture. So if individuals are interested in clinical trial participation, there's various websites that you can go to. There's clinicaltrials.gov, where you can see clinical trials of all types. So that might be a little overwhelming. So the Alzheimer's Association has a great website, trialmatch.alz.org, and they have kind of a little questionnaire that I believe you fill out, and then you're routed to a page that shows you which trials are close to you that you might qualify for. Antidote.me, this website is great. It was actually developed by people who wanted to make the process of clinical trial participation easier. And then also, Rubric has a great quiz that is entitled, "Is Clinical Research Right for Us?" It's a 4-minute questionnaire. I apologize that the website is so long, but if you want to just Google the title of the questionnaire and rubric, I'm sure it'll pop up in your Google search. But this can help individual living with dementia or a family member determine, is clinical research right for us, and hopefully help make it a little less intimidating. So finally, I'm going to leave you with a variety of resources. There's lots here. There's a brainhealth.gov website, which is a great website with lots of information on brain health. The Memory and Aging Center at UCSF is also a great website. There's a lot of movement in women's brain health, and the Women's Brain Health Initiative, pardon my misspelling there, initiative, their website is very informative. They take the science and put it into easily understandable articles. They have a blog and a magazine. This is often a good resource. Then the Parkinson's Foundation, for those who have Parkinson's disease or are family caregivers, they have so many great resources on their website. Us Against Alzheimer's is also another great resource. They have a Women Against Alzheimer's kind of subgroup that is doing a 30-day brain challenge at bebrainpowerful.org. I mentioned throughout the presentation that they're starting to learn that aging brain diseases are developing 10, 20, 30 years before symptoms ever start to appear in an individual. So this bebrainpowerful.org, this 30-day challenge is great because it helps you realize what are the things that could be impacting my brain health. And it's really open to people of all ages, but the sooner you can develop brain healthy habits, hopefully the less risk you will have for these aging brain diseases. Of course, the Alzheimer's Association has a great website, alz.org. They have support groups that are helpful for family caregivers. And then I promised you the Association for Frontotemporal Degeneration. The website is listed there. And that website is phenomenal. They have lots of great resources, as is the Lewy Body Dementia Association website. So again, a lot of people know about Alzheimer's disease, the Alzheimer's Association, but there are dementia-specific websites or disease-specific websites, Parkinson's, frontotemporal degeneration, and Lewy body dementia, that are definitely worth checking out. So with that, I want to thank you all again so much for joining us talking about aging brain diseases, and hopefully these resources, this information can help you better serve the older adults and family caregivers you work with on a daily basis. So with that, Steve, I know we just have a few minutes for questions here, so I'll pass it back over to you.
Okay, great. Thank you very much, Lakeland. Yes, let's get into jump into the questions right here. Sending your questions right now, everybody, and we've got some to get started with here. First question for you, Lakeland. Can you explain a little bit more about how early diagnosis saves money? I understand how it gives more time for financial planning, but how does it actually save money?
Yeah, that is a great question. I should have gone into more detail. Again, there was so much info to cram into this hour. So the financial impact, if you look at the ability, so if an earlier diagnosis takes place, if the individual is able to get the available treatments that exist, or the family and the individual is able to learn more about the disease, plan ahead for care needs, then in the long run, it ends up saving money. So I'll give you an example. So if an individual living with earlier onset Alzheimer's disease is able to plan with their family, making their home friendly for them to age in, if the family is able to keep them at home longer, it will delay their placement in a memory care facility or long-term care facility, so a nursing home. So that saves in terms of an economic impact. So if the family is paying out of pocket for memory care, if they're able to delay that person going into a memory care facility even by 6 months to a year, 2 years, 3 years, that's a significant economic saving for that family. If an individual eventually has to go to a nursing home, if the family can help the individual stay home longer and delays a nursing home placement, oftentimes if the family were to spend down and go on to Medicaid, that would end up impacting the federal government. So healthcare system, federal government. So if the person is delayed in having to move to the nursing home, even again by 6 months or a year, then that ends up saving in terms of those Medicaid dollars, or even dollars that family would have to pay out of pocket for that nursing home placement. So I hope that gives you a better idea. So, and it can also help families get connected again to resources sooner. A lot of local chapters of Alzheimer's Association and these various disease-specific groups, they have, grants for in-home care or various supports for the family. Again, that will impact them in a financial way, hopefully, because they've planned ahead. They're able to draw upon those resources and get the support they need. So again, they can help their loved one usually live longer with that aging brain disease in their familiar surroundings in their home. So I hope that helps to answer that question, but that was a really good one. Thank you.
Okay, great. Next question, Lakeland. If a person refuses to get diagnosed, the family is convinced that there is some type of dementia. Is there a technique or a procedure that can be used to get this person to agree to get a diagnosis? A very tough question.
That is a really tough question. I know that the Alzheimer's Association's website has some good articles on this topic. It can be hard to accept that there are changes in cognition happening. If you as a family member are able to contact your loved one's medical office ahead of time before an appointment and just express, I've noticed changes in my loved one's cognition. Could the physician suggest a cognitive screening? Again, it's part of that Medicare wellness check. So it can be part of kind of a routine visit. Also, I've heard families have a success story of, if it's a spouse situation, the spouse says, I really am concerned about my cognitive health. I'm going to get my cognition checked. Will you do it with me? That sort of an approach sometimes works as well. So again, I know that's a very challenging situation. But again, if you can be I don't want to call it sneaky or going behind your loved one's back, but if you can express concerns, then hopefully the medical professional can bring it up as part of the routine kind of screening process. So I hope those couple ideas are helpful, but I would go to the Alzheimer's Association's website. If you just Google like diagnosis or search on their website diagnosis, they have some great articles that will pull up. So thank you for that question.
All right. Well, Lakeland, unfortunately, we've reached the end of our hour here, and we're just about out of time, but I want to thank you for a great presentation and for joining us today. Thank you so much.
Thank you, everyone.